in today's Health Matters, as we prepare to celebrate the 4th of July, we also want to make sure that you're protected from injuries caused by fireworks.
To avoid a visit to the emergency room this holiday weekend, we are turning to the experts. Lindsay Watkins is a physician assistant at Northwell Go Health Urgent Care, and she's joining us now with some tips on how to stay safe. So good morning, Lindsay. Thanks for joining us.
Good morning. Thanks for having me.
So tell us what it's like for you guys during this holiday season. The fireworks, barbecues, are you guys super busy at urgent care? You see a spike in visits?
Yeah, so summertime we always get that little bit of a bump because people are out and about doing all those fun summer things. So we do tend to see the sunburns, the bug bites, the lacerations, some of those bumps and bruises. And also we have a lot of visitors that come to New York and Long Island. So we definitely see a little bit more traffic coming through our centers at Northwell Go Health Urgent Care.
All right, so Lindsay, we know that fireworks are illegal in our area. However, people do turn to sparklers, which are often permitted. But what kind of injuries can sparklers cause?
Sparklers are tricky. They look like they might not cause too much injury. They look like they're pretty safe, but they actually can cause harm, especially when used by children. So it's really important to make sure that if kids are using them, that they're doing it with parental supervision or an adult nearby. And definitely those extra littles probably shouldn't be holding them.
Yeah, because sometimes they get burned, right?
They can very much burn.
So what do we do if we get burned by a firework or a sparkler?
Sure. So unfortunately, if we do sustain a burn, you want to make sure that first you are safe. You want to move away from any unsafe area, and then you want to make sure that you're using lukewarm water over that area right away for about 10 to 15 minutes. But really important, you don't go too cold. And then we want to look and see how bad is this burn and maybe seek care.
What happens if you go too cold?
So unfortunately, you can actually cause more damage. So ice and really cold water can actually damage the skin even more. So we want to make sure that we're just using that lukewarm, cool water.
And if you see blisters, is that a good thing or a bad thing?
Unfortunately, it's bad news if we see some blisters. It means it's a little bit more of a severe burn. So it may need a little extra care, like going into an urgent care center or seeing your primary care provider.
Because people make mistakes, though, on how they treat a burn, right? I mean, like you said, the ice, it makes it worse. What other things can we do to soothe it? Because some people say use toothpaste.
No, so I would strongly advise against using toothpaste, right? We use it to clean our teeth. That's way too harsh for our skin. So, at Northwell Go Health Urgent Care, we always advise our patients, you want to make sure that you keep it nice and cool. You can apply a topical antibiotic like bacitracin is a good option. But again, using things like butter or oil would be a very bad choice.
Okay, good to know.
And do not use toothpaste.
Yeah. Please do not use toothpaste.
Gotcha.
Yeah, that graphic said common.
Yeah, it was like.
No, it said common mistakes.
Okay, common mistakes.
Yeah,
okay, good.
don't
Want to make sure here. When is it time, in your opinion, to go see urgent care or a medical expert with a burn or injury?
Of course, yeah. So if at any point the burn is really large or on our hands, our face, or sensitive areas of our body, or if you notice over a day or two, it becomes much more red or hot, you have a fever, or if you noted some drainage that doesn't look right, it looks either a little like pus or smells, those are reasons to absolutely get checked out right away.
All right, Lindsay, great tips. Thanks so much for being with us this morning, and hopefully you don't have too much of a busy weekend.
Well, we're happy to take care of anyone that comes in.
All right. Thank you again.